My name is Farhad Ravandi. I'm Professor of Medicine at the Department of Leukemia at the University of Texas MD Anderson Cancer Center. And I am going to talk about how we have been and can be using the immune system for managing patients with acute myeloid leukemia. Using the immune system is not a new concept, and we have been relying on graft versus leukemia effect in allogeneic stem cell transplant for many years in treating patients with acute myeloid leukemia. However, there are now new and novel strategies that are being developed based on our increased understanding the biology of AML and also the ability to develop very exciting novel agents. These include both cellular-based agents such as CAR T cells, which are very early in development, and in fact there are very few patients who have been treated with them, but also immune-based strategies using monoclonal antibodies, which include both immunotoxins and radioimmunoconjugates, as well as bispecific antibodies. Bispecific antibodies or T-cell engaging antibodies essentially recognize both T cells and a marker on the surface of the AML cells, and they recruit T cells to the close proximity of the AML cells, resulting in activation of T cells and killing of the AML cells. And clearly, this is a completely novel concept, although it has already shown to be effective in managing patients with acute lymphoblastic leukemia. Immune conjugates are also available already. Gemtuzumab ozogamicin has been approved, which is a CD33 antibody linked to a toxin, but there are a number of other agents that are in development. Essentially what these drugs do is they recognize a marker on the surface of the AML cells, and they get internalized within the cells, and then they release their toxin. Radioimmunoconjugates are also an interesting concept. Essentially here the load is a radiation emitting particle, and this can result in the killing of the cells when they get in the proximity of the cells. So overall, there is a lot of excitement in using the immune system to treating cancer in general. And we have seen this with the use of checkpoint inhibitors in solid tumors. These agents are still early in the field of acute myeloid leukemia, and but potentially can also help be recruited into our armamentarium for treating with patients with acute myeloid leukemia. There's a lot of excitement about a number of targeted strategies that produce very high responses in AML, and with achieving higher responses, we are becoming more and more interested in what we call measurable residual disease, and a number of these immune-based strategies may be highly useful in trying to eradicate measurable or minimal residual disease.